lands on your desktop or your mobile device, you may want to know who I am. I'm a spiritual teacher, a non-dual teacher, an owner of treatment centers that treat addiction, depression, anxiety, trauma. I am the co-developer of two mindfulness training programs that are worldwide, the Living Inquiries program and the Kilby Inquiries program. This video was sent to you for a reason. You and I may not know each other. In the course of developing what I would call somatic-based self-inquiry, in developing those tools, I was able to use those tools on a chronic pain situation that is normally not healable or curable. People with this condition do not tend to get much better without medication or medical treatment. I went off of all medication and medical treatment and went into deep somatic-based self-inquiry. And what I discovered, it's a meditative practice that takes you into sensations and reveals what mental stories are connected to that sensation. I discovered in my own experience that the pain was not actually physical. It was created by unresolved trauma that had um, kept itself in that vulnerable area, unresolved trauma and emotional repression, namely anger repression and fear repression. I didn't just do that without any guidance. I was following the work of John Sarno, Dr. John Sarno, who talks about the fact that many of these chronic pain conditions that people all over the world are experiencing are actually the pain in those conditions isn't actually coming from the abnormality. Those areas of pain become like a repository for repressed, unconscious thoughts, stories, and programs. Although he was a pioneer in this area, now modern science is catching on. I have posted, for example, a slew of studies that science has been doing somewhat quietly because it's not in the headlines, discovering the direct link between emotional repression and unresolved trauma with chronic pain. So, a lot of these scientific studies are mirroring John Sarno's research and his work. The work that I've done and I am doing with other people mirrors that. I found these same insights in my own experience. I have a condition for which I should be in pain now: spinal stenosis, bulge disc. Most people with that condition are in pain for the rest of their life. The inquiry work that I did took that pain away. In the course of that, I was able to resolve some very unresolved traumas that I couldn't otherwise reach in my experience through therapy or any other spirituality. And most of all, I was able to lift up anger repression, lift up anger and fear that had been repressed. It was in lifting these things up into my awareness, meditative awareness, and watching them, learning how to lift these things up to see them. That's how the healing took place. I'm not the kind of person who has a lot of money behind me. I've never been that kind of person. I don't have a large organization behind me. I own some treatment centers. Those centers do the work that they do every day. There's no engine here behind this. It's just me. I'm a sole spiritual teacher out here who discovered something. And now I'm just trying to form a team with people out in the world who understand what I'm saying and who know that the way the chronic pain has been treated isn't working for a lot of people. So if you're in the medical field and you're noticing some low success rates, if you're noticing that you can relieve pain somewhat, but not completely in most people, if you can see that people are getting medical treatments and just some temporary relief, many of them, medications, same thing. And also, people are becoming addicted to these medications. The reason I think all of that is going on is because we're not treating chronic pain the right way. Some chronic pain situations, Dr. Sarno said, come from a traumatic injury, but he stated that most don't. They're actually these repressions, this trauma. That's exactly what I saw. I just happened to have tools called the Kilby Inquiries that were able to bring that up, whereas I couldn't find any other therapy or modality that would do that. So I know that I've stumbled upon something here. And so I'm just doing what I know to do, which is to reach out to anyone out there who may be in this field, the medical field, or maybe you're a researcher. Maybe you're someone that just has an interest in this. So I'm looking to form a team of doctors, researchers, investors, anyone else who can bring something to the table because I think we've discovered something that can help millions of people. Millions. I'm already helping people in my small way after my own pain healed, and I'm seeing the same results. It's a slow process, but people are lifting their repressions and their traumas, and they're experiencing decreasing pain and then sometimes vanishing pain. So, this is a big deal. It's worth getting on here to talk to you about. All that I ask is if I've piqued your interest at all, just have a conversation with me and learn about this really rich set of inquiries that we have and how we're using them. You can reach me at killibycenter@gmail.com. Just send an email and put repression pain in the subject line, and then I'll know that you responded as a result of this video. Thank you.